So recently I posted a video about the placenta and what you can and can't do with it after birth and what hospitals may or may not do with them after you deliver. Finally, I also address the social media frenzy about the placenta being worth $50,000 and if that's really true. I'm going to tag that video in my caption. But just today, I saw this article from the New York Times. Her face was unrecognizable after an explosion. A placenta restored it. The same qualities that make placenta so valuable during pregnancy make them profoundly useful for healing burns and wounds. So why do we throw so many away? Let's chat about this. Now, this article tells a story of Marcella Townsend, who had severe burns after an explosion, a propane explosion in her home. Second and third degree burns covered most of her body, and her face was unrecognizable. So in addition to skin grafts, surgeons used placental tissue to help restore her skin. And to put things in perspective, this is what her face looked like before the placenta was used to restore her skin. And this is what it looks like now. That is incredible. So what is it about the placenta that makes it useful for burn patients? It has stem cells, cytokines, and collagens, all that help with what we call regenerative medicine, meaning it helps to regenerate tissue. Research has also shown that placenta-derived grafts can reduce pain, inflammation, heal the burns, prevent the formation of scar tissue and adhesions around surgical sites, and even restore vision. Now, using the placenta and its membranes and tissue for a skin graft is still considered a form of transplant. But it doesn't cause the same potential immune response to that transplant like what could potentially happen when skin grafts are used that are from cadavers or animals. The membranes in the tissue from a placenta are what's called immunologically privileged, meaning that the recipient won't reject those tissues and membranes from the placenta. Now, placentas used for regenerative medicine come from patients who have donated their placenta. And there are many uses for the placenta in medicine. So the argument I made in my last video is we know that the placenta is very valuable because it has so many uses for medical treatments. So why don't we incentivize patients to donate them rather than disposing of them in the hospital? While donating the placenta without anything in return is very nice and it's very altruistic. It would be really nice if we compensated patients for doing so. And I'm not saying giving them $50,000, but some kind of monetary incentive would likely result in many more patients choosing to donate their placentas rather than them being disposed of as medical waste. What are your thoughts? Tell me in the comments.